I want to introduce our speakers one by one. Our first speaker is Ann O'Connor. So Ann O'Connor currently serves as the acting director for the Division of Nutrition, Physical Activity, and Obesity at the Centers for Disease Control and Prevention, where she previously served as the deputy director. She served as the CDC Chief of Program Planning and Advancement and was the Associate Director for Policy in the Office of Public Health Preparedness and Response. So help me welcome Ann to the podium.
Thank you. It's really my pleasure to be here. And I did hear about that snowy day that you and Bill thought this up. So anyway, just nice reflections. And I really enjoyed all your quotes. I actually don't have any in my remarks today, but it's sort of a favorite presentation technique of mine. So thank you so much for starting the conference that way. So what a great start to this important summit. It's really my pleasure to be here, and really my pleasure to welcome you on behalf of the Centers for Disease Control and Prevention. And I really want to recognize, as Debbie mentioned, sort of the tremendous work that's been accomplished by the folks in this room. The commitment and dedication really is critical, has been critical to move forward our shared goal around improving the health of children and really working in early care and education in general. It's just, I would really suggest, I'm assuming we're all very action-oriented folks, right? So we want to get on to the next thing and get things done. And that's why we're successful. But please, I encourage you to take a moment to really just celebrate, what you've been able to accomplish. And that'll help propel you forward to the next set of work. So, I'm sure most of you are familiar with CDC, but just a quick, primer in terms of our role with childhood obesity. We support obesity prevention through applied research, development of evidence-based programs, technical assistance to the field, and we also, of course, a key role of CDC in most areas is to sort of monitor trends, health trends. In this case, we monitor both adult and childhood obesity. And, we're so aligned with some of the points that Debbie made in terms of what we're looking for. And what we're looking for are effective, feasible, scalable programs that make a difference. And I will say, the other thing about us at CDC is I think that we are all people who want to make a difference, as I think many of you in this room are as well. So we're just so committed to this work. It's just want you to know that. But we don't, these things don't happen alone. They happen with partners, and CDC, we can't do our work without partners. So we've just really appreciated working with partners, federal, state, local, private, nonprofit, kind of whatever it takes to get the work done. So we've certainly appreciated that over the years. So just a quick point about some accomplishments, and I'm so pleased that Debbie took a moment to step back and appreciate the fact that we've begun to see a decrease in obesity rates for children. That's just, fantastic news. Still too high and still more to be done, but I think many of these efforts have certainly contributed to that. So I think we need to be happy about that. So since CDC and Nemours initially launched, and then other partners, the Healthy Kids, Healthy Futures work, CDC has been pretty busy ourselves. One of the things that we did was develop our guiding framework for our work. It's called the ECE, the Early Care and Education Spectrum of Opportunities. And if there's anybody in this room who doesn't know about the spectrum of opportunities, then you must absolutely not leave this conference until you know about it, because it's really our Bible. It's how we think about how to work with states and locals and providers to really launch this work. So it's extremely important, and we're extremely proud of that framework, and it seems to be working to help generate action. We also, after the original launching of this work, really got to work with our states through our state health departments to really generate more action, and I'll speak about that in a second. And then clearly the partnerships with many of you and others in the field have been critical. I think, you already mentioned Bill Dietz, but I would be remiss without recognizing his critical role in launching this work. So is he here? I don't, right there. Right, okay, you were right behind me, so I didn't even see you. Thank you, Bill. So just a couple of other activities that I think we're proud of. In addition to, we actually fund state health departments, and we're very, very proud that every single state has to engage in ECE work and try to improve the systems within their state. Now, it's not a lot of money, but it's enough money to really start to look at, to work, have the health department work with the child care partners and many of the other partners in the state to get some of this work done. And then we're also very proud of the cooperative agreement that we have with Early Learning Collaboratives with Nemours, which really, has blossomed working with 6 states. And by the end of 2015, basically 9 states are implementing learning collaboratives, reaching approximately 150,000 children. So we're very proud of that. So states, and then just one state example, because we're very proud of our state work. Some states have started to make really good progress in this area. So just one example is in South Carolina, where they've embedded obesity prevention standards into many components of their state early care and education systems. So they've included 27 physical and nutrition activity standards into their statewide quality rating and improvement system, which impacts about 85,000 South Carolina children. So we're very proud of that. And they also developed a provider toolkit and online trainings that are now required as part of professional development. And I'm sure there's other stories, but just wanted to highlight that. So what is CDC? So that brings me to sort of where is CDC's commitment to moving forward? And I think, our commitment continues to be strong both in our division and also in an agency. Working with our partners, we're going to continue to push for the critical system changes that we all know need to occur to be able to support the early care and education providers. And really, I'm going to reiterate some things that Debbie said is, I think our charge to you is let's take this to the next level. What can we do? What can we do next? So, and to do this, I think from our perspective, we have to continue learning. We have to, when we initiate a new program or a project, we need to rigorously evaluate it. We need to figure out what is really going to work. And as I mentioned earlier, not only what is effective, but what is feasible to scale up to really, really start having even more of an impact than we've already had. Other things that we're focused on are continue to look at technical assistance models and develop the best technical assistance and training models that we can. And again, to reach as many providers as possible. And again, with this ultimate goal of scale up. It's incredibly important for us. And then I think CDC is also committed to working with everyone in this room and Nemours and others on whatever type of action plan comes out of this convening. So we're very, very pleased about that. So I guess I'm just going to close with just a couple comments. So I was looking at the agenda. There's some fantastic leaders who are presenting today, so including 2 key CDC leaders in this area, and I want to recognize them, and that's Meredith Reynolds and Carrie Doima, who just work tirelessly every single day on these issues, as many of you do. So my advice to you is, as you attend the sessions, enjoy them, network with your colleagues, enjoy yourself. It's a great time to connect with partners. And as Debbie alluded to, we don't always have a lot of time to do that. So please definitely do that. And finally, just a big thank you to all the partners who sponsored this summit. It's just wonderful to have a group like this together to talk about how we're going to accelerate the work moving forward. So the foundation that you all have built over the last few years is incredibly important for sustainability, especially sort of during this transition time. So I think CDC remains very, very strongly committed to this work and moving forward. Thank you very much.
And next we have Deirdra Chester, and we are really pleased to be deepening our work with USDA. Dr. Chester is the National Program Leader for Applied Nutrition Research in the Division of Nutrition at the Institute of Food Safety and Nutrition at the National Institute of Food and Agriculture at the USDA. She also provides leadership for the Agricultural and Food Research Initiative, the Child Obesity Prevention Program, and the Foundational Program. With that, let me ask Deirdra to come on up.
So first of all, I want to tell you that it really gives me great pleasure to offer you a warm welcome, although it's extremely cold outside. On behalf of USDA, the National Institute of Food and Agriculture, I want to first congratulate the planners and conveners on a successful conference grant that was awarded through the Agricultural Food Research Initiative Childhood Obesity Prevention Program. This conference grant allows us to co-sponsor this very worthy event. It is an opportune time to discuss how our specific roles, whether in research, policy, or practice, can play a part in ensuring that we overcome barriers and that we facilitate healthy weight among our youngest citizens. This includes access to healthy food and physical activity in their communities. We owe this to our younger generation. It is gratifying to note that the agenda of the Healthy Kids, Healthy Futures Summit covers a wide range of very interesting items relating to the commitment or recommitment to early care and education as a space for childhood obesity prevention programming and research. We are aware of the tremendous effort made and the large investment in funds and scientific effort by a number of you sitting in the audience. Each of us has a specific role, and we accomplish more when we work together. This is one of the reasons why our investments in conferences and summits like this are so important and they're paramount. I want to provide a small update on the FY 2017 President's Budget. I think that when that announcement came out last week, it was amazing. I was sitting at my computer and it was like ding, 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 ding. And I was like, what's going on? And so there were many emails and calls, and people were just, they were inquiring, what does this mean? Does it mean that you have more money in childhood obesity prevention? And so I think at that point, I had to remind people that it's the president's budget. We're always hopeful that that president's budget will be accepted, that, I cross my fingers, eyes, toes, and everything every time it comes out. But it is the president's budget. And so what I want to say about that FY 2017 president's budget, that it provides a total of $700 million for our AFRI programs. And if you're not familiar with the investment in that program right now, it means that it would double the investment in that program. AFRI is what NIFA USDA considers our nation's premier competitive, peer-reviewed science program for fundamental and applied agricultural sciences. So the question is, how does this $700 million, what does it look like? So it's requested, and it consists of two parts. So the two parts are the $375 million, the discretionary funding request. So this discretionary funding request will continue to target climate change, pollinator health, antimicrobial resistance, bioenergy, water use and availability, and microorganisms and their environments, to include the microbiome. And then there's $325 million mandatory funding requests. So this one-year mandatory funding is part of the government-wide investment in research and development. Mandatory funding will be used by NIFA to invest in what we consider a systems approach that comprehensively identifies solutions to complex challenges in sustainably increasing agricultural production. Now, what's important in that is that this systems approach is necessary if we're to combat childhood obesity in children, and that's where we would get our part of that funding. And the other thing is, if any of you in the room have applied for the AFRI Childhood Obesity Prevention Program over the years, you know, we get a lot of applications. NIFA itself gets approximately 4,000 applications. That's FY 2014. We were able to fund about 390, so that's about 10%. And so what we hope is that if we get this influx of funding, that will actually help our funding rate, because it means that if we get the same amount of applications, we will be funding more of those applications. So it's thought that this would kind of help us increase our rate of funding. Now, the full level of AFRI funding will enable investments in agricultural science, research, education, and extension. For the last 3 years, the AFRI Childhood Obesity Prevention Program has focused on multifactorial or multifunction projects only. So you had to include research, education, and extension. And we hope that these positively impact the entire supply chain, meaning that they provide good jobs, that they safeguard our food, improve personal health, that they ensure quality ecosystem services provided by the environment. Fully funding AFRI is imperative to address growing global food demands, support a workforce that will identify solutions to these complex agricultural challenges, and strengthen economies at both the local and national scale. Fully funding AFRI will enhance research opportunities for new investigators and support graduate students and postdoctoral researchers who will contribute to the agricultural workforce. I've decided that I'm not going to work forever, so that means that it's important to train the next generation of scientists. And to date, we have made a considerable investment in childhood obesity prevention through the AFRI Childhood Obesity Prevention Program, and we plan to continue that. The investment in agricultural research will strengthen the American economy, communities, and people. And the call for increased federal funding for agricultural food research resonates repeatedly, and in unity from state and local governments, organizations, universities, and national leaders. In concluding, we wish you every success in your noble endeavors to develop the youngest of our citizens. We also wish you every success in your deliberations and a very pleasant stay in Washington, D.C. Thank you.
Linda Jo Doctor is a program officer at the Kellogg Foundation and has really been a leader in the field for a long time. And she focuses in her work at Kellogg on the areas of food, community and early childhood, and place-based initiatives and equity, so just a range of things. So without further ado, let me bring up Linda Jo Doctor.
So, hello everybody, and thank you so much on behalf of the Kellogg Foundation, and it's an honor to be here, and again, we welcome you. We also do want to thank and acknowledge the leadership of Nemours, Debbie and Allison, and all the other supporters, the planning committee. We should do a clap, you know? Yeah, we're going to do that. Yeah, okay. We can do it many times. We can do many times for organizing this gathering. And again, an honor to be here. Before a few comments, I do want to introduce my colleague, Jennifer Odell from our Education and Learning team, who is where? Where are you? There you are. That's Jennifer, right. So at the foundation, our Education and Learning team and our Food, Health, and Well-Being team have now joined forces to support this very important work. We know there is a very strong business case for investing in enhancing the quality of early childhood education. And we know that creating the conditions that promote health, access to fresh, healthy, good food, safe water, I'm going to say that again, safe water, I have to, coming from Michigan, safe places to play, enhances the quality of the early learning environment. We know the power of parents as partners and facilitating policy and systems change. And we all know the unique opportunities that we have before us of enabling and policies to move forward and accelerate these changes. We also know when you bring together people from multiple disciplines, health, food systems, education, nutrition, equity, we all have different perspectives, different training. We even use the same language for the same thing. It gets very interesting. But we also know from this space comes tremendous creativity and breakthroughs and opportunity for change. So we look forward to the learning, to the dialogue, and to see what happens next. Thank you very much.
So Monica is a senior program officer at the Robert Wood Johnson Foundation, and having just joined RWJ in 2015, her work focuses on supporting policy strategies to help children achieve a healthy weight. And prior to joining the foundation, Monica directed YMCA's, the YMCA, the USA Healthier Communities Initiatives. So with that, I really want to, again, thank their support and have Monica come up.
Hi, good afternoon. So I was actually at the last summit when I was working for the YMCA of the USA, and I'm just so delighted to be here again, and also to see all the folks in the room here, as well as the wide breadth of topics and conversations that we're going to have over the next couple days. I bet many of you would agree with me when I say for far too long, our country has really thought about being healthy as simply not being sick. Over the past few decades, we as a nation have worked to improve health by focusing primarily on the healthcare system, neglecting to address other critical factors that impact people's health, such as early childhood development and early learning environments. So I'm delighted that these conversations are now starting to blend into one. Unfortunately, healthy living is often seen as an accomplishment that only those who are already fit can truly achieve. Our health and well-being is often unduly and unequally influenced by income, education, ethnicity, and zip code, and those repercussions are felt across the nation. When young children experience poverty, hunger, family violence, or substance abuse, we know that they are more likely to drop out of school, end up in prison, or become addicted to drugs. So for this and many other reasons, the Robert Wood Johnson Foundation has committed time, energy, resources, and I would say passion in trying to address the health of our children in this country. This is in part why the foundation has invested more than $1 billion to try to reverse childhood obesity in our country. We have many strategies to try to address childhood obesity, and amongst those strategies are making sure that every child can enter kindergarten at a healthy weight. We want to make sure that physical activity is the part of the everyday experience for all children. And we want to make sure that healthy foods are affordable, available, and the desired choice in communities and neighborhoods across our country. And finally, we also want to eliminate the consumption of sugar-sweetened beverages for all children under 5 years old. So those are a lot of big goals, part of the reason why I decided to join the foundation, because I am very passionate and want to work on these goals. Building a culture of health means creating a society that gives every person an equal opportunity to live the healthiest life they can, whatever their ethnic, geographic, racial, socioeconomic, or physical circumstances happens to be. We must embrace a more integrated, comprehensive approach to health and healthy early care environments, and one that is strengthened by the perspectives, ideas, and creativity of so many. I'm quite certain after hearing Debbie articulate the objectives of this summit that that's exactly what we're going to do over the next couple days. I also want to express our appreciation and gratitude to the Nemours organization around how much time and energy and passion that they have given to this work, and really appreciate their vision and strategy to get us here today. Thank you very much.
So Linda is an associate program officer in the Children, Families, and Communities program at the Packard Foundation. She's responsible for grant making in the health portfolio, including early childhood nutrition and children's health insurance coverage and access. So let me welcome Linda to the stage.
Wow. Well, I've heard the phrase, that's a tough act to follow before, but after following
Debbie and Deirdra and Anne and Linda and Monica, I can honestly say that's 5 tough acts to follow. Each of you in your organizations and agencies are playing such important leadership roles in this space, and it's really an honor to be up here with you all. And I, too, just want to specifically acknowledge Debbie and her team at Nemours just for all the work that's gone on to put on today's event, all your leadership in the space, and also just what a wonderful thought partner you've been to the Packard Foundation as we've begun to explore the early child nutrition area. The David and Lucile Packard Foundation has been working on children's issues for over 50 years, but we're really the new kid on the block when it comes to thinking about healthier early care and education settings. For the last 10 years, we've really been laser focused on 2 areas. One, ensuring quality early care and education environments for young children, and the other being improving children's health care coverage and access for all kids here in the United States. And so as we as a foundation have begun to ask ourselves, what else is needed to support the healthy development of young kids? How do we make sure all children enter kindergarten ready to learn? Early nutrition has emerged as a really key answer to that question for us. And we've heard a little bit today, and I'm sure we'll talk over the next few days about the important role that early nutrition as well as physical activity plays in terms of health outcomes. And for us, that's important, and we're also really interested in how important this work is in terms of children's brain development and making sure that young kids get the start that they need so that when they enter kindergarten, they're really ready to learn alongside their peers. So I look around this room today and I really see so many people that have been instrumental in this movement for many years, and for people who I really know and respect. And so as Debbie went through the goals earlier today, I really think we've got the right set of people here in this room to be asking ourselves the question, what next? And we're really honored and privileged to be here to help think that through with you. So thank you for having us, and we look forward to the next 2 days.
Thank you, Linda. So I think we all know that we can't make progress without partnerships. And Nemours is really fortunate that we have so many wonderful partners, those who just spoke, and so many of you in the room. So I do want to take a moment to thank the supporters of this summit. They are the Kellogg Foundation, the National Institute of Food and Agriculture at the USDA, the David and Lucile Packard Foundation, the Robert Wood Johnson Foundation, American Heart Association, the Penn State Better Kid Care, Blue Cross and Blue Shield of North Carolina Foundation, Kaplan Early Learning Company, the Centers for Disease Control and Prevention, and of course Nemours. So let's stand up and give up an applause.